If you're looking at Medicare supplement plans and you keep seeing Plan G and Plan N come up, you're not alone. These are the two most popular Medigap plans available to new Medicare enrollees right now, and choosing between them is one of the most common decisions people face when they first get on Medicare. Today, I'm breaking down exactly what each plan covers, how they differ, and when each one makes sense, and something a lot of people get completely wrong about when you can actually change your supplemental plan because the answer is really not what most people think. So, before we get into the comparison, let me quickly explain what a Medicare supplement plan actually is for anyone who's newer to this. Original Medicare Part A and Part B covers a lot, but it doesn't cover everything. There are deductibles, copays, co-insurance, and every time you use your benefits. And one of the biggest risks most people don't realize is until it's too late is that original Medicare has no out-of-pocket maximum. There's no cap on what you can spend in a given year if you have a serious illness or a hospital stay. A Medicare supplement plan, also called a Medigap, is private insurance that wraps around original Medicare and helps pay for those gaps. So you keep original Medicare as your primary coverage, and the supplement steps in to cover some or all of what Medicare doesn't pay. Medigap plans are standardized by the federal government, which means a Plan G from one insurance company covers the exact same hospital medical benefits as a Plan G from any other company. The only real difference between each carriers is the premium you pay and the company's financial stability and customer service reputation. That standardization is important because it means that when you're comparing Plan G from different companies, you're comparing apples to apples. And the only thing that really should drive your decision is price and carrier quality. So, Plan G is currently the most comprehensive Medicare supplement available to new enrollees. So, here's what Plan G covers. It covers the Part A deductible, which in 2026 applies per benefit period for hospital stays. It covers Part A coinsurance and hospital costs. It covers Part B coinsurance and copays, meaning after you pay your Part B deductible, Plan G picks up the 20% share of out-of-pocket costs. It covers skilled nursing facility coinsurance, it covers Part B excess charges, and it covers foreign travel emergency coverage up to plan limits. So the one thing that the Plan G doesn't cover is the annual Part B deductible. In 2026, that deductible is $283. You pay that once per year out of pocket, and then after that, Plan G handles the rest. So with Plan G, once you've paid your Part B deductible for the year, your financial exposure for Medicare covered services is essentially zero for the rest of that year. It's a very predictable, clean coverage structure. Now, Plan N covers most of the same things Plan G does, but with a few key differences that translate into lower monthly premium. So Plan N covers the Part A deductible, the Part A coinsurance, skilled nursing facility coinsurance, and foreign travel emergency coverage. And like Plan G, you're still responsible for the annual Part B deductible. Now, here's where Plan N diverges. So first, Plan N does not cover Part B excess charges. I'll explain them what that means in a moment. Second, Plan N has copays on some of the outpatient visits. You can pay up to a $20 doctor copay on office visits, which could be less, and up to a $50 copay on emergency room visits that don't result in an inpatient hospitalization. So if that happens, obviously then it's covered, right? So after those copays, Plan N covers your remaining 20% of Medicare approved costs. So with Plan N, your out-of-pocket exposure is a little less predictable. You're not paying 20% of every claim, but you do have those visit level copays and you have the excess charge exposure depending on where you live and who you see. So let me explain Part B excess charges because this is a piece of the Plan G and versus Plan N comparison that trips a lot of people up. When a doctor accepts Medicare, they agree to bill at Medicare's approved amount, but not every doctor is required to accept the Medicare assignment. So a doctor who doesn't accept the Medicare assignment can charge up to 15% more than the Medicare approved rate. That extra amount, up to 15% above what Medicare approves, is called the Part B excess charge, and it's your responsibility to pay it. Plan G covers the excess charges, Plan N does not. Now, here's the practical reality. Whether excess charges matter to you depends heavily on where you live and which doctors you see. If you live in a state where excess charges are prohibited by law, this part of the Plan G versus Plan N comparison is essentially irrelevant for you. There are currently 8 states where excess charges are banned or heavily restricted: Connecticut, Massachusetts, Minnesota, Ohio, Pennsylvania, Rhode Island, and Vermont. Really prohibit them outright. New York technically allows them, but caps them at 5% above the Medicare rate, and so most providers in New York don't bother billing them given that restriction. If you live in one of those states, excess charges are largely non-issue, which changes the Plan G versus Plan N math in favor of the Plan N. If you live outside those states and you want to see any Medicare participating doctor, including ones who don't accept the assignment, Plan G gives you more complete protection. So how do you actually choose between them? The core of this decision comes down to one question: the difference in the monthly premium, essentially between the Plan G and the Plan N. Is it worth the additional coverage that the Plan G provides? So Plan N typically carries a lower monthly premium than the Plan G because you're taking on a little bit more risk. It's technically kind of like a step below the Plan G. The visit copays and the excess charges exposure. If you're relatively healthy, you don't see doctors frequently, and you live in a state where excess charges aren't an issue, Plan N can be a smart way to get strong coverage at a lower monthly cost. On the other hand, if you want the cleanest, most predictable coverage structure possible, pay your Part B deductible once in January and then have virtually no cost sharing for the rest of the year, Plan G delivers that. It tends to appeal to people who value simplicity and complete protection over squeezing out a lower premium. So neither plan is objectively better. The right answer depends on your health and how often you use your benefits, which state you live in, and how much the premium difference actually is in your specific market. So I would say the excess charges, last time I checked, about 98 to 99% of doctors in the country who accept Medicare also accept the Medicare assignment. So it's likely you'll never run into that. So it's usually a non-issue for most people. But some people don't want to deal with that $20 doctor office copay potentially, so they just go with the Plan G, even if they technically could save a little money, and that's fine too. Here's the part of the Medigap that I don't think gets nearly enough attention, and it's the part that can lock people into a plan or lock them out of one entirely. So when you first turn 65 and enroll in a Medicare Part B, you have 6 months for the Medigap open enrollment period. That starts the month you turn 65 and then 5 months after that. So during that window, insurance companies cannot deny you a supplement plan and cannot charge you more because of your health history and cannot make you wait for pre-existing conditions to be covered. That window is the best time to buy a supplement plan, period. No exceptions. So once that window closes, most states allow insurance companies to use medical underwriting to decide whether to approve your application and what price. So that means if you have diabetes, heart disease, cancer history, COPD, or almost any other significant health condition, you could be declined outright or charged a much higher premium at a higher rate. So most underwriting typically looks back about 2 years at your health history. Conditions you've been diagnosed with or treated for in the past 2 years are fair game. But an example, if someone had cancer, but they've been cancer-free for at least 24 months or 2 years, then they're usually in the green light to have a better chance of getting approved. Now, here's the mistake I see constantly. People assume that the annual enrollment period, or otherwise called AEP, October 15th through December 7th, is when they can change their Medigap plan. It is not. AEP is just for Medicare Advantage plans and Part D drug plans only. It has nothing to do with supplement plans at all, and that's not a lot of people understand that or realize that. That's okay. You can attempt to change your Medigap plan at that time of the year or any time of the year. But outside of a guaranteed issue right, you'll typically face underwriting. So when can you change your supplement plan without underwriting? There are a few situations. First, if you lose your Medigap coverage through no fault of your own, you may have a guaranteed issue right to buy a new plan. Second, if you're leaving a Medicare Advantage plan and returning to original Medicare under certain conditions, you may have a guaranteed issue right there. Typically, that means if you're moving outside the service coverage area and they disenrolled you for that, or your Medicare Advantage plan's contract just ended in your county, so which means they're taking away that plan out of your county. Sometimes that can be a guaranteed issue right as well. So a couple of unique situations. So third, and this is where it gets interesting, a growing number of states have birthday rules or anniversary rules that give you an guaranteed issue or kind of an annual window to switch to a plan without medical underwriting. As of now, 15 states have active birthday or anniversary rules. Virginia, for example, gives you a 60-day window from your birthday. California has done 30 days before, 60 days after. Delaware typically gives you 30 days before and after. Idaho gives you 63 days from your birthday. Illinois gives you 45 days. And keep in mind, these birthday rules and anniversary rules, they all work differently, right? So some of them you can switch from an equal to a lesser plan. Some of them you have to enroll from just a plan letter, one plan letter to the same plan letter. So from a G to a G or an N to an N. In most cases, you cannot upgrade, as they call it. So you cannot go in most cases from an N to a G using any birthday rule at all. So it's typically either down a plan letter or across the same plan letter. Sometimes Illinois is very particular where it's only age 65 to 75 and it has to be the same insurance carrier and equal or lesser plan letter, right? So they all vary a little bit. A few other states to mention, there's Indiana, Kentucky, Louisiana, Maryland, Nevada are a few other examples, as well as Oklahoma, Utah, West Virginia, Wyoming. I'll make sure to include the full list of them down in the description below, but you get the idea. Definitely check that description, see if your state is one of those states, and that could be actually a good sign for you there. Also, New Mexico is the most recent addition. Their birthday rule takes effect January 1st, 2027. So those living in New Mexico looking to save money on your supplemental plan or to make sure that you're always on the better rate each year, that's going to be something to really take advantage for next calendar year. So if you live one of these states, your birthday or policy anniversary is your annual opportunity to shop your supplemental plan, potentially moving from a plan G to a plan N or switching carriers for a lower monthly premium without going through underwriting. So if you don't live in one of these states and your open enrollment window is closed, underwriting is the reality. This is exactly why the decision you make when you first enroll in Medicare carries so much weight. Getting into the right plan at the right time with a clean bill of health protects your options for the long run. Let me bring this together. Plan G is the most comprehensive supplemental plan available to new enrollees. You pay the Part B deductible once a year, and after that, your Medicare cover costs are essentially covered. It's clean, predictable, and complete. Plan N covers most of the same ground at a lower monthly premium with visit level copays and no coverage for Part B excess charges. It can be the smarter financial move depending on your health, how often you use benefits, and what state you live in. The best time to buy either plan is during your 6-month Medigap open enrollment period when you first get into Part B. After that window, underwriting applies in most states. And with a 2-year look back on health history conditions you've been treated for can affect your eligibility. AEP does not apply to Medigap. If you're in a birthday rule state, your annual window is your birthday or policy anniversary, not October 15th. Know your window, make an intentional decision, and get into the right plan while you have the most options available to you. Now, if you like this video, please like the video, subscribe so you don't miss on what's coming next. Drop a comment below with your questions. I read every single one. This video is for educational purposes only. I have 8 years of experience in the Medicare industry. This is not personalized advice. Please consult a licensed professional for guidance specific to your situation. Follow for more Medicare education, and I'll see you guys in the next one.